Hey, Defy Nation, this is Danielle. Now, you guys all know that I'm an avid cyclist, and the love of cycling has only grown from my first spin of the pedals. Because of my love for the sport, Richardson Bike Mart is my only choice when it comes to equipment, accessories, and the most knowledgeable cycle experts in DFW. Their massive selection is only outshined by the extent of cycling expertise and caring by the staff. Remember, choosing a bike is personal and precise, so make Richardson Bike Mart your only choice too. Visit them today in Frisco off John Hickman Parkway, Dallas off of Garland Road next to White Rock Lake, or the Richardson location at Campbell and Coit. Check them out at bikemart.com. That's BIKEMART.com.
We could be
What's up, Define Nation, and welcome to another episode of Define Your Health with Danielle Girdano, strength through knowledge. And Define Nation, the guy that you all love, Dr. Patel from Baylor Scott & White Orthopedics of Garland, is here and graciously said that he would give us one more show to answer all of your questions, which we appreciate the response, and we appreciate you telling us what's on your mind, because we don't know unless you tell us. So that's absolutely awesome. So props to Define Nation. Now, you guys may remember Dr. Patel graduated the top 10% of his medical school. He is published, and the coolest thing, in my opinion, is he was the team physician for the University of Colorado and Denver University. Doc, thank you so much for coming back.
Well, I love it. Well, thanks again, and happy to do it.
Awesome. Well, I want to get right into the nuts and bolts, because on the last show we left off with a couple of questions still remaining, and there was a lot of emails sent in about this particular topic, so I do want to make sure that we cover it. Knee replacements. It seems like they're becoming more common in folks. Maybe that has something to do with obesity. Maybe it doesn't. I don't know. But why do people, in your opinion, need to get knee replacements? Is it because of weight? Is it because of injuries? Is it because of just having a very active lifestyle and the knee simply wears out? What's your opinion, Doc?
Most common reason to have a knee replacement is arthritis. And that arthritis, basically the tread has worn out on the tire, can happen for multiple reasons. It can happen from a previous injury. It can happen because of obesity, or just wear and tear. And right now we're seeing so many knee replacements, and that number is going to exponentially increase, is because of the baby boomers.
Okay, well, you mentioned you're doing a lot of knee replacements. Are there differences in knee replacements? And if there is, what are those differences?
So there's multiple different categories when someone says knee replacement. Do they have a partial knee replacement or a full knee replacement? So a full knee replacement replaces all the surfaces in the knee, whereas a partial just replaces part of the knee that's worn out. Now, if you look at just total or the entire knee replacement, there are different variations on different types of implants that are put in, but fundamentally they're all the same. They have they shave the arthritis off, and they put metal on the femur bone, on the shin bone, and then a plastic cap in the middle of the two to help with articulation or movement.
Okay, again, ow. I think we're just going to name this show Ow. Oh my goodness. that just sounds just horribly uncomfortable. Just wow. So then, now technology has obviously changed over the past, let's say 35, 40 years. So can you kind of walk us through the stages of what was a knee replacement maybe 40 years ago, and how has it evolved?
So the idea of knee replacements hasn't changed much. So again, just shaving the arthritis out and putting metal and plastic in the knee. But what has changed is the plastic. So if you think about a surface continuously motioning on a piece of plastic, you think that the plastic's going to wear out. So the advancements have been in how much wear pattern can the plastic get. So the plastics now that we're putting in can have 20 to 30 years of lifespan if put in appropriately. So the other big thing is the instruments that we use and the incisions have gotten smaller, so they're more minimally invasive, because a lot of the guides and the instruments that we now use in knee replacements are more incision friendly, so you don't have to have a bigger incision, and that helps with some of the post-operative recovery. Some of the other big advancements in knee replacement have been with pain control after knee replacement.
Okay.
So previously, people had to stay in the hospital 5-6 days after knee replacement to control their pain, but now you're looking at, people are trying to get out of the hospital post-operative day 1 or 2 because of all the different things that the surgeon and the anesthesiologist who controls the pain medicine can do after surgery.
Well, so basically the plastics become more durable, and the healing time has been shortened, and how you deal with that healing time has gotten better. That's kind of what I took from what you said. Is that a good summary?
Absolutely, yeah.
Okay, well, I tell you what, Doc, we're going to leave knees alone as we cut away to a commercial break, and we are going to tackle the back. And oh my, the emails that we got about the back. Remember, Defy Nation, this segment is brought to you by Soy Joy All Natural Fruit Bars. Wherever you are, wherever you're headed, Soy Joy helps get you there, so grab some today. Delicious energy is waiting at us.soyjoy.com. That's us.soyjoy.com.
All we're looking for is love and a little light. Love and a little light.
Trying to contain skyrocketing healthcare costs? There is an answer. Define offers a comprehensive wellness program that measures your employees' physical, mental, and nutritional progress, providing reports that help HR save your insurance aggregate big money. Define comes to you, bringing all the necessary workout equipment. And with Define's stress management program, your team will be healthier, refreshed, and focused.
Every company that has tried Define is still a client. Find out why at defineyourhealth.com. That's the letter D, F-I-N-E, yourhealth.com.
Hey, Defy Nation, this is Danielle. We all have people in our lives who we love and only want to give them the very best in care as they age. Lexington Medical Lodge in Farmersville, Texas has a sincere and personable staff to care for your loved one. In designing the facility, they actually studied the resort and hospitality industry for inspiration. Wow! Lexington Medical Lodge combines the industry's latest treatment techniques and equipment with a highly personalized approach to care. This patient-centered combination of technology and skilled care enables their rehabilitation guests to return home as quickly as possible, along with providing their long-term guests with enhanced well-being and quality of life. And you know I'm a fan of quality of life. Visit them today at LexingtonMedicalLodge.com. That's LexingtonMedicalLodge.com. And we are back, Defy Nation, with our very special guest, Dr. Patel from the Baylor, Scott and White Orthopedics of Garland. And you have definitely proven yourself as an expert, and one of the areas where it seems like people have the most problems and a lot of injuries and a lot of pain comes from the back. So I want to just dive in to the back. What is the most common type of back injuries that you've seen in your experience?
Well, I wouldn't say an injury per se, but the most common complaint for the back is back pain. And that's basically because of arthritis of the back.
Okay. So the last time that you were on the show, we talked about one of the most common actual back injuries, which was bulging disc and herniated disc. So what exactly is the difference between those two injuries, just to clarify?
So again, it all comes in the arthritis and wear and tear. Bulging disc and a herniated disc are basically the same thing in the spectrum. A bulge, so between the bones of your spine, there's a cushion, a pillow. And that pillow, as you get older, loses its pliability. So when it loses its pliability, it starts to bulge out. And it starts with this little bulging and then ultimately goes to a herniation. And there's 3 types of herniations, and type 3 being the most severe. So in essence, the bulge disc and a herniated disc is on the spectrum of the same thing.
Okay, so the herniated disc, if the bulging disc, it's basically a progression, is what you're saying. One leads to the other. Okay.
Yes.
Okay, so the question of, can these be healed? I would guess no, but can these be healed?
And correct. Unfortunately, they cannot be healed. Things that can help is weight loss, again, improving your core strength. Not smoking. Smoking can lead to a lot of back pain.
And why is smoking directly leaded to back pain? That's very interesting to me.
Because what happens with smoking is the nicotine decreases blood flow, and in my viewpoint, perspective, that blood flow decrease to the disc and creates them to wear out quicker and bulge.
Okay, so I was going to ask you if these are preventable and how, but it really sounds like staying active and fit, keeping your body composition, at a normal, reasonable level, and not smoking. That's what it kind of sounds like. Is there anything else that can help prevent these?
That's great. That's exactly what you need. You'll have back pain here and there, but to prevent chronic back pain, that's the things you need to do.
Okay, well, I want to move on to scoliosis because we had some great questions about scoliosis. What exactly is scoliosis, and what exactly causes it?
So scoliosis, it's Latin for bent. It's called a bent spine, and it's basically an abnormal curvature of your spine. Your spine has curves that are built in naturally, but as you get older and the arthritis sits in from the wear and tear, it develops an abnormal curvature. You can have scoliosis in adolescence, and even congenital scoliosis. You're born with scoliosis. However, the most common scoliosis that we see is an adult-acquired scoliosis, and that's from arthritis.
Okay, so then is this something that can be healed or per se straightened with surgery or any natural means?
Yes, and so most commonly what happens in adult-acquired scoliosis is that leads to back pain and nerve problems down your legs. And when that does happen, it can be straightened by putting titanium rods in your back.
Okay, again, that does not sound like a pleasurable thing to do. I'm assuming that's only the very severest cases, correct?
That's right. Some majority of the time, you don't have to have surgery, but it depends on how severe your symptoms are and what your surgeon recommends.
Okay, so let's move on to neck and spine injuries, and really specifically injuries, not something that's a natural progression. What are the most common types that you see? Is this water diving accidents? What are you seeing?
By far, car accidents and motorcycle accidents. They comprise majority of the cervical, the neck, spine injuries that we see.
Okay, and that's primarily from what activities? I'm sorry.
Car accidents.
Okay.
And it could be multiple things: landing on the concrete, being ejected from a car, having significant whiplash, and so. Just imagine going in a car 60 miles per hour, and then next thing you know, you're going 0 miles per hour. That can have a huge toll on your neck.
Okay, and then, so, things like whiplash, obviously, going to a chiropractor, at least in my opinion, can help that. And there's different things that you can do to kind of, help that injury along. But what about life-altering injuries, spine injuries, specifically a broken neck, a broken back, severed spinal cord injuries, those type of things? Can you kind of walk us through those? What are really the differences? And really, are you seeing those a lot? Are those as common as we may think?
Surprisingly, they are common. So when I think of a spine injury from an accident, I think of, is there just a fracture or a broken neck, or is there a fracture with nerve damage? And that nerve damage could be as a nerve pinched, or is a spinal cord severed. A broken neck, depending on how broken it is, typically requires surgery. And if it's just a nerve that's pinched, you can relieve that pressure. However, if it's a severed spine, those are the most severe injuries, and typically it's very hard to recover from those.
But it sounds like some of these injuries can be overcome, if I'm understanding you correctly.
That's right. So depending on the severity of the nerve damage and the age, I think age is huge. Older patients have lower ability to regenerate and heal nerves, whereas younger patients have a much higher potential. So if you look at an 8-year-old kid, his prognosis would be much higher, much better than an 80-year-old person.
Okay, so then how does degeneration of the disc, since we're kind of talking about the individual discs here, between the vertebrae cause someone pain if this isn't this life-altering injury? And you had mentioned earlier that really back pain is the most common thing that you're seeing, not necessarily a back injury. So how does this all play in?
So the pillow between the bones is meant to stabilize the spine and keep the natural curvature there. When the pillow deflates, the natural curvature goes, you're putting more pressure on different joints in your back, and that leads to inflammation around those joints. And it can even inflame the spinal canal. On top of that, you can have nerves that get pinched, and then you can have sharp shooting electrical type pain down your arm or your leg, and that's what leads to the painful part of it. It's basically the arthritis that sets off inflammatory response in the joints of the spine or pinches a nerve.
And very quickly, how exactly does the role of pinched nerves play into chronic back pain, and are they preventable?
Pinched nerves, chronic back pain do go kind of hand in hand. Again, it's with the arthritis of the back. Back pain is much more difficult to treat with surgery, whereas a pinched nerve is easily treated with surgery. You just relieve the pressure. So in essence, they're related to one another. However, one is much more treatable than the other.
Okay, and we got to go to a commercial break, but when we come back, I'd like to stay with kind of bones in general here, talking about osteoporosis, because there was a lot that came up about that. And remember, Defy Nation, this segment brought to you by Wonderfully Raw, organic, non-GMO snacks bringing taste that will bring a smile of amazement to your day. Visit them today at mycocorunes.com. That's mycocorunes.com. Hey, Defy Nation, this is Danielle, and finding nutritional density in snacks these days can be a real challenge, especially for the little ones in your world. When I reach into my pantry, I grab a bag of Wonderfully Raw. Whether it's their Cocoa Rune, Brussels Bites, Dippers, or Snip Chips, I know both my taste buds and my hunger will be satisfied. See the wide variety of flavors sure to please all members of your family at mycocorunes.com. That's mycocoruns.com. Hey, Defy Nation, this is Danielle, and I got to tell you guys that I found the perfect getaway destination that brings harmony, peace, and fun for any family or couple looking for that weekend getaway. Farmersville, Texas is simply the most hospitable, friendly, and charming town you'll find here in Northeast Texas. Whether you celebrate the rich history of veterans in Texas and an all-American hero at the Audie Murphy Festival, check out the fresh harvest creativity at Farmers and Fleas Market, or even get back to the harmony of nature riding your bike, a horse, or hiking through 19 different towns along the Chaparral Trail. Truly a diamond in the rough and made with recycled materials. How awesome is that? There is also a wide array of taste bud tapping unique restaurants along the fascinating and charming historic downtown square with amazing shopping too. Thousands of unique, fun, or antique finds await you there. What are you waiting for, Defy Nation? Start making your plans today at farmersvillechamber.com. That's farmersvillechamber.com. are back, Define Nation, with our very special guest, Dr. Patel from Baylor Scott and White Orthopedics of Garland. And you are just providing such wonderful information. And, you know, when we're talking about bones, I don't think you can really get away from talking about osteoporosis. So how common is osteoporosis, and really what are the severity levels?
Osteoporosis is very common in the geriatric population, and it's going to get worse. Numbers have shown that the numbers of osteoporosis incidents in the U.S. is just going to continue to rise. And there are three severity levels of osteoporosis. There's two severity levels of bone disease. I shouldn't say osteoporosis, because before osteoporosis you have something called osteopenia. So when someone looks at your bone, it could be normal. You can have osteopenia, which is right before osteoporosis, and then you can have osteoporosis.
Okay, so what exactly is a bone density test, and why is it useful? I mean, how does it work, and how do you use the information that you gather from it?
So it's a 5-minute exam where you basically get an x-ray of your femoral necks or your hips and your spine.
Okay.
And with that information, you're basically given a number. 0 to 1 is normal bone. 0 to -1 is normal bone. -1 to -2.5 is something called osteopenia, and then anything less than -2.5 is osteoporosis. And you're given this T-score, and your score, if you're an 80-year-old female, you're being compared to a 30-year-old female in her bone health. And basically you're seeing what your deviation is at that age.
Okay, so, you know, that really leads into the prevention of osteoporosis. And in your opinion, is there ways to prevent this, or is this just a natural degeneration that kind of happens to at least a large majority of people?
Majority of osteoporosis is preventable, and that's why it's such a big issue. Our bone in every adult peaks at around 25 years of age, and after that, it just decreases in density, so it gets weaker and weaker every year. Unfortunately, when women go through menopause, they lose estrogen. Bone needs estrogen to maintain its strength.
Okay.
And so therefore, the goal is prevention, and that prevention is to, one, drink as much, get as much calcium and vitamin D intake before the age of 25 to have the highest peak of bone, and on top of that, to continue the level of vitamin D and calcium so you don't lose as much bone every year. The other things you could do are weight-bearing exercises. Obesity has an implication on osteoporosis, not drinking too much alcohol, and smoking, and getting enough sunlight.
Okay, well, this brings up an interesting point, and I really want to get your opinion on the Harvard study. It came out, I'm guessing now, probably about 1.5 to 2 years ago, that points to the myth that dairy consumption helps this condition, and that in the U.S. actually has the greatest consumption of dairy in the world, but we have the highest rate of osteoporosis. And so, first of all, I want to get your opinion on the actual study. And second of all, I really want to talk about the difference between calcium as a mineral, which is what bone needs, versus dairy.
Yeah, great questions. So I kind of agree with the Harvard study. If you look at how much calcium you really need, and you also need vitamin D to absorb the calcium. Mm-hmm. So I would, challenge every one of the listeners to see how much vitamin D they're actually getting. Because if you're not getting enough vitamin D, the amount of calcium you're taking in it's not doing you much justice. So I would agree that the Harvard study says that just dairy consumption that has high calcium but maybe not as much vitamin D may not be as beneficial.
Okay, and so what is your opinion then of the relationship between magnesium and vitamin D and calcium?
So you need all three of those, but primarily the vitamin D and calcium. It's easy to get the magnesium in your body. Magnesium also helps you absorb the calcium. So the relationship between all three of them helps with the homeostasis and how much you can absorb. and keep that absorption in your body.
Okay, so then how does bone tissue actually regenerate? What I mean, because we know that bone is a living tissue. How does it actually regenerate?
So there's cells. There's cells that make bone, and then there's cells that take away bone. And the reason those cells take away bone is when you're not having adequate vitamin D or calcium intake, those two vitamins are stored in your bone. And so those cells say, hey, my vitamin D or calcium's low, so I need to break down more bone. And so if you have an adequate amount of vitamin D and calcium, the cells that produce bone want to store the excess amount and therefore will regenerate bone.
Okay, so as a medical doctor, more on the traditional side of medicine, not saying that you're a traditional doctor, but, chiropractic care, what is your really opinion on having regular chiropractic care to keep the spine and neck in good condition, transversely keeping the central nervous system in good condition and connected to organs and brain and sending signals and all that good stuff?
Yeah, chiropractic care can actually be very beneficial in the certain patient populations. However, you have to caution basically how bad is your spine. If you have a lot of pinched nerves or you have something what we call stenosis of the back or the neck, sometimes chiropractic treatment can actually make that situation worse. So I think it has a value to patients, but I would caution it to be used in everyone.
Okay, and let me just throw out this last question to you. What would be one thing, if you had to really give your top tip for healthy bones and really just keeping the overall body healthy from your perspective as an orthopedic doctor, what would that be?
Well, I would say three things.
Okay.
Be healthy, live a good life, and make sure you're getting the adequate amount of vitamin D and calcium.
Okay. Well, I tell you what, Dr. Patel, again, this show has just flown by, and I cannot thank you enough on behalf of Define Nation. Thank you so very much.
It's been my pleasure, and I've had a great time.
And if people have additional questions, can they reach you directly?
Absolutely. People can contact my office. My number is 469-800-2663, and I'd be more than happy to help them.
All right. Well, I hope they do reach out to you. And again, thank you so much for being on. And Define Nation, do remember that we're giving away that $500 prize pack via our social media outlets. We're going to post the question, and if you're the first one to have the correct answer, you are going to snatch it up. So until next time, Define Nation, remember, motivated, dedicated, and highly recommended. Bye-bye.
For 20 years, Nordic Naturals has been dedicated to making the best fish oil on the planet. Their motivation? The heartfelt belief that a single nutrient can change lives. Their love for what they do and the people they do it for drives them to do it right at any cost. That means products that are outrageously fresh, obsessively tested, and passionately perfected. Products that taste so pure, you'll love them. Try Nordic Naturals award-winning omega-3s today and taste pure love. Available at natural product stores nationwide or at NordicNaturals.com.